Shall we start?
Yes, ma'am. Yes, ma'am. You can start.
Okay. So, how many are there now? 40, 38.
30.
Yeah. So, all are exam going this session? I mean, December or?
Majority of are going, ma'am.
Okay.
But I think few people
Uh,
otherwise have also joined.
okay. So, have all of you gone through the last year's question papers? Question paper? Have you gone through the last year's question paper? And was it? I mean, tough or easy, or this is more about the third paper because I think the first two papers maybe you're getting enough training. This is more about the third paper. So if all of you have gone through the paper, how do you find it as tough or easy or okay paper? No one is typing means
I think you can answer in chat.
you can answer in the chat. Tough. Okay. So, so I understand that many of you are worried that we don't have, you don't have training. You are not trained to answer such questions, and that is why you find it tough. It is not that these questions are like many of the questions that they are now asking in paper three. Paper three is actually family medicine and public health. Okay. So when you think from a outsider's point of view, I mean, not when you're going for exam or not when you're a student, when you're thinking from an outsider's point of view, 90% of the part or 95% is actually relevant to family medicine and public health. PSM that now they're calling it more as public health. So if 95% is actually very much relevant to family medicine, if you think from an outsider's point of view, but I know that when we go for an exam, you might be thinking why this is asked to us who have no training and all those things. We're not trained in that way, and then how do we write these answers like that? So now the thing is, more than what you know, it is how you put the answer across to somebody who values the paper. That is more important. Okay. Yeah, obsgyn and pediatrics also in that because yeah, your third paper includes all those things. Yeah. So in a way, it is actually if you read a bit of a bit of pediatrics, a bit of public health, it you can actually pass that paper. But the problem is like last year's question paper. I've got the question paper. I'll just go through. I'll just tell the one of the just for sample. Okay. So the first question was 42-year-old female, excessive menstruation since few months, heavy bleeding since few months with HB of 5 gram percentage. Okay. And they have asked the evaluation in terms of history, examination, and investigation. And how will you manage this lady's problem? Okay. So, I think maybe I don't know if I should think from your point of view, but if I think this is a very common scenario that can come to your OPD or in family practice. So, even if you don't have training, you should have read about it. Okay, so what all things you will include in the answer? That is a question. Not just this paper, in any paper, when you write, it is always better to write it in a systematic way rather than points here and there. Now, they have asked the question in a very systematic way. They have asked for evaluation in terms of, they have clearly mentioned history, examination, and investigation. Sometimes they just ask evaluation and you are lost. You don't know what to write. Okay. in the first question, patient is not ready to get admitted. How to counsel them? I do not remember that part in the question. I've seen the question paper, but maybe I'll check that. But I saw the question paper, but I'm not sure that this part was there in the question. Okay, so let me, I'll go back and check. But even if that is asked, it is easy to answer. Okay, so when you, all these things you know, but when you write, since they have asked very clearly about history, examination, investigation, that means they have very clearly made what all points you should write. A lady with heavy menstrual bleeding with HB of 5. So what are the two problems there? There are two problems. One problem is abnormal uterine bleeding or heavy menstrual bleeding, and the second problem is anemia. Okay, so what all will you ask in the history? You will ask history related to the bleeding, isn't it? So what are the history you will ask related to the bleeding? You will ask the duration of the bleeding, the days, number of days the bleeding is there, number of pads the lady is using, to know the volume of it. And then you will ask the associated symptoms, like you will ask the LMP, you will ask the PMP, previous menstrual period, all those things you will ask, and how many days the duration of the cycle was. And you will ask about, since this is a 42-year-old, you assume that this is a lady in the reproductive age group. So other associated symptoms, what all you will ask? You will ask about pain, that is dysmenorrhea, whether there is a spasmodic or a congestive dysmenorrhea. You will ask about dyspareunia. You will ask about vomiting, fever, anything associated with that. Okay, what are the symptoms that was there in the last few days? Why do you ask about fever? To rule out PID. And fever, vomiting, systemic symptoms to rule out PID. You should ask about any cervical or vaginal discharge. Okay, whether it is a blood-stained discharge that happens for a few days and then there is bleeding. These things, you can just write history and write dyspareunia, deep pelvic pain. Why do you ask that? To rule out endometriosis. Fever, systemic symptoms, pelvic pain, to rule out pelvic inflammatory disease. And the duration and everything. If you know that why you are asking a question, just write that you are asking this to rule out whatever causes there in your mind. Okay, now the second part is her obstetric and menstrual history. You have to ask very clearly, Menaki. You have to ask about how many children she has. You have to ask whether she is on IUCD, I mean intrauterine contraceptive device, which can cause heavy menstrual bleeding. Any other contraceptive use, even progesterone, can cause abnormal uterine bleeding. So you have to ask about that, and then you have to ask about the complications that you expect in this patient because of anemia. So what are the history you'll ask related to anemia? You'll ask about pedal edema, you'll ask about breathing difficulty, you'll ask about palpitations. So if you classify, or if you organize your answer in this way and write the history like this, when you organize like this, it seems so simple, isn't it? So just, you know all these things. You know that this patient has two problems. One is the abnormal uterine bleeding and the other is the anemia. So history related to each you have to ask. Okay, and you know you have to ask other causes of anemia also. Even though she has heavy menstrual bleeding, you have to ask about whether there is any other bleeding disorders, whether there is a chronic liver disease which is causing coagulation problems, whether she is on any other drugs that can cause bleeding, like the anticoagulant drugs.
दोनों तरफ देखते रहते हैं.
So all these things have to be asked so that you will, when you classify and write, it will be easy for you. Okay. And now the examination part, the same thing. Related to abnormal uterine bleeding, what all will you ask? Now the patient has come with an HB of 5. So what are the first things that you look in the examination? You will look whether the patient is in shock or not. That is what you want to know. So what all you look, the general symptoms like tachycardia, tachypnea, all those, the pallor, all those things you will look for. And then you will look for features of failure like the pedal edema, bilateral basal Krebs, S3, all those things. Now you'll check for the abnormal uterine bleeding. What are the examination findings you can get? You can get an abdominal mass, which can be a fibroid or something. you have to do a per speculum and a per vaginal examination to see if there is a local trauma, if there is any cervical erosions, all those things. Okay. Now the investigations. Investigations again related to the anemia, what all you do? You will do just as you evaluate any other anemia, you have to do what are the 4 things that you will do? I mean, the 3 things that you will do in any anemia to arrive at a diagnosis: MCV, peripheral smear, and reticulocyte count, which will give you an idea about what is the cause of anemia. Okay. And with that, and if needed, you can write like this: these things I'll do, and the rest of the things, don't write I will do, but these are the investigations. And in addition, depending on further this thing, you can write the causes of, I mean, see, to write the investigation chart of anemia from Harrison is very difficult in this answer, because you just have 5 papers to write the answer, 5 sheets to write the answer. Okay, you need not write all the investigations of anemia. What is relevant here? You want to know whether there is iron deficiency anemia, or is it a normocytic normochromic anemia due to the due to bleeding. Okay, that is what you want to make sure. So you just have to write the important things, and whatever is I mean, if you can say that if no diagnosis is this, you will go for further evaluation anemia like the iron studies and the B12 studies and all those things. But these 3 things, MC will give you a clue to whether it is macrocytic, microcytic, or normocytic. And reticulocyte will give you a clue whether it is due to hemolysis, bleeding, or anything. And then peripheral smear will give you a clue of most of the things. So these 3 are very much essential in any anemia. And rest of the things, if you have time and if you think, you can just mention that if there is no cause diagnosed by this, you can write. That is one thing. Now, the next thing is the management. So that is the history, examination, and investigations are over. Now coming to the management. How will you manage this lady? First of all, this lady has come with abnormal uterine bleeding. So what are the first things that you will give? You have to bring down, I mean, you have to reduce the bleeding. So first thing is, you have to see whether the patient is in shock. If the patient is in shock, you have to give colloids or then blood transfusion if the patient is in shock or cardiac failure. Blood transfusion, or if there is volume depletion, blood transfusion. Otherwise, packed cell transfusion. But if the patient is stable, first of all, you will give tranexamic acid, NSAIDs to reduce the bleeding. Okay, tranexamic acid has to be given. NSAIDs like mefenamic acid has to be given, which will reduce the bleeding. And then you have to further, I mean, the cause, depending on the cause of any abnormal uterine bleeding, the further long-term treatment will be there. So treatment of, if the patient is in shock or failure, the treatment of current abnormal uterine bleeding, then the treatment for long-term treatment for the cause of the abnormal uterine bleeding, then the long-term treatment for anemia. All these points should be there. Okay. Now, if there is a 4th part which asks about, so one thing is the cause of AUB. You all know the causes. Unless the cause is asked, please don't just start the answer by saying that these are the causes. No need to say that. Whenever you write the history examination, you can write that this I am doing to rule out this. Okay. And when you write the management also, there are some things that you can manage. Like if it is an ovulatory dysfunction, you can manage by giving oral contraceptive pills, cyclical oral contraceptive pills with a low dose estrogen, or you can give progesterone centri, or you can give GnRH analogs. All those things you can mention. But if it is a leiomyoma, or if it is a surgical things that need to be surgically managed, you can write that if it is a leiomyoma which has caused, I will refer to the gynecologist. But other things like Mirena IUD you can give. The other, you can write it like this: Mirena IUD is an option, DNC is an option, and DNC with endometrial sampling you can take, because it is a abnormal uterine bleeding. There can be endometrial biopsy has to be done. So that you have to take hysteroscopy and endoscopic endometrial biopsy has to be taken. Coagulation disorders you have to evaluate whether there is any chronic liver disease, all those things. So in your examination also, you are checking for the stigmata of chronic liver disease or coagulation disorders. Genitourinary TB and all usually is, even if you don't write, it is not an issue because that has other symptoms. It usually has other symptoms. You can write it as you will do the systemic symptoms, you will check to rule out genitourinary TB. But so far what I have told, if you write, you will get enough marks. Okay, now regarding the management of anemia. Regarding the management of anemia, you can write that you will supplement with oral iron, and what are the indications for parenteral iron, what are the indications for blood transfusion. Now come to the question of counseling for the patient who does not want admission or blood transfusion. You have to tell that you have to count. That is where the role of family physician comes. You are all counseling this to your patients, but to write in a paper, it is difficult for you. I know that all of you do this to your patients. You counsel them about the side effects of anemia. What are the side effects? Just like we told, the patient can go in for a cardiac failure. So you advise that if this anemia is not corrected, you can go in for cardiac failure, cardiac compromise, and these things can happen. So, and all perfusions, all organ perfusion will be less. And so you have to undergo this because your HB is like this and you are in shock. You need to have blood transfusion. Another thing is, if you do not want admission, we will evaluate and we'll tell her this is a cause which requires a surgical treatment or an admission and treatment. So if you do not do this, this is what is going to happen. That is, your anemia will worsen and your bleeding will be continuous and you will end up in failure. And if you do not do the necessary investigations, you might not identify a malignancy. All those things which you know you can write, I'll counsel the counseling. These points we will write, and that is what they expect from you. And there is nothing hi-fi about it. These are all, you are all doing this in your daily practice. The only thing is you are worried that whether we are writing the right thing. All this I know that you are all asking. So you just have to write that I'll counsel this. I will ask for the patients, because you know there are some principles of family medicine. You have to ask the patient about what is the concern that the patient is not wanting admission or blood transfusion. What are the ideas, concerns, and expectations? There are some words in family medicine which you can put in the answer so that that will fetch you more marks. Why is the patient concerned? Is it because of financial reasons? Is it because there is no bystander for the patient? So you have to address all those issues and find out somebody to support these issues. Or if you are in a private hospital, you can refer to a government hospital where if it is due to financial issues. So find out the cause why she does not want admission or blood transfusion or investigations, and address those issues. That is what you have to write as counseling. I hope I am clear. Is that clear? Can I move on to the next question? If you write these many things, even if you write half of these things, you'll get pass mark for this answer. 5 out of 10 is guaranteed if you write half of the points that I said. Okay. So the problem with most answers is that you don't write it, you don't think and organize. So because time is very limited, so when time is limited, you are frightened that so that you don't organize things and you just write random this and that. Okay, so for that, what you will do? You have to practice writing exams. You just take a question paper, previous question paper, be it diploma or DNB question papers. Diploma question papers, only 2 sessions are there. Even a DNB question paper, there is not much of curriculum difference for both of you, both DNB and diploma. The only thing is that research or thesis is not there in your curriculum. So just take a question paper and try answering, try managing time. Then you will slowly learn to organize how to write an answer. Because on the exam day, if you are writing for the first time, organizing things, it is going to be difficult. We got so many questions about assessment. Can you please explain what to mention in assessment? The same thing. Assessment means, well, how will you assess? You will assess by history, you will assess by examination, and you will assess by investigations. So relevant to the question and how the question is asked, you can divide it into assessment by history, by examination, and by investigations. That is how you assess a patient. Now, when I say the second and third answers, I'll come to more about the differences from the first question. At the end, maybe if you have doubts, further, if it is not clear, you can ask. Okay. Now the second question is a 4-year-old boy, active, playful with HB 4 gram. Same pattern, evaluation, history, examination, investigations, and management. Okay. So this is a boy with 4 gram percent HB, but still active and playful. So what could be the causes? So it is a compensated patient. Okay. Patient has anemia, but the patient is compensated because he is still active and playful. He is not sick. Okay. So in a child in 4 years, what is the difference from the previous question? Previous question was a 42-year-old female with HB 5 gram due to excessive menstruation. This is a 4-year-old boy. Again, the nutritional causes like iron, vitamin B12, all this. So in the history, you have to ask about the diet pattern and whether the vegetarian, whether there is pica to rule out there is iron deficiency anemia, whether there is whether the child is vegetarian, what is the diet pattern, 24-hour diet recall you can do. Now, because due to, in relation to the diet, what else will you ask? You will ask whether how the birth order of the child, how many siblings are there in the family. Because of that, is a child malnourished because of the social, I mean anemic because of the socioeconomic status of the child. Okay, so all these things will come in that. So, the socioeconomic status, whether they have enough support, financial and otherwise. Now, in another cause for a 4-year-old child with a compensated anemia, can someone put it in the chat? Other than the nutritional causes like vitamin B12 and iron. Just to know if you are thinking in that direction. Can anyone post it? Okay, hookworm infestation, good. Another one. Common in children, child age, in an age group of more than a plastic, thalassemia, very good. Thalassemia trait or this. So thalassemia you have to ask, because thalassemia is starts manifesting from that age. So you have to ask about family history, whether the parents had any bleeding, anemia, or whether there was recurrent blood transfusions for the parents, although or for the siblings. So that history should come. Celiac disease, of course, malabsorption you have to ask, other things you have to ask. So that is how you organize your answer. This much history, if you write, it is done. You have got more than the pass percentage for that history part. Now, what about the examination? Think in the same lines. What all will you examine it to see? Same as the previous question. Just to know if the patient is stable, what all will you examine? And then about iron deficiency anemia, what all will you examine, like the koilonychia and all those things. Now, what all will you examine related to thalassemia? I will look for hepatosplenomegaly, all those things. Now, what all will you look for vitamin B12 deficiency, any neuropathy, any other symptoms, hair fall, all those things. So classify like that and write the examination. Then the investigations. Still, it's the same thing, the evaluation of anemia, what all you will do. In this, you can even write that, you can draw a flow chart. See, if you don't get time to manage, you draw a flow chart. It need not be the flow chart as in the textbook. Don't try to reproduce flow charts in the textbook. You can write flow charts that will, that you prepare, like you will do this investigation. And if that is, if the MCV is high, what will you do next? If the MCV is normal, what will you do next? If MCV is low, what will you do next? And if reticulocytes count, what will you think of? What will you do next? If it is normal, what will you do next? Just organize and write like that. That is about history, examination, and investigations. Now about management in this child. Again, management depends on the severity of the condition. If the patient is in failure or in shock, the same thing you have to write. If the patient has, if the child has, if the child is stable, you will treat according to the cause. How will you treat iron deficiency anemia? How will you treat vitamin B12 deficiency? What will you do for thalassemia? Just write the points. And another thing I want to stress is that sometimes just the marks will be 5 marks. And you were thinking of just 2 points for that answer. And you will be wondering, 5 marks they have asked. So should I fill 3-4 pages for that? No, just write the point related to that. Marks does not depend on the weight of the paper. Okay. If you think that the points, these points are there and that is it, just write that. Nobody is weighing the answer paper to give you marks. Okay. So I'll tell you how the paper is marked. At the end, I'll tell you. Or even now I can tell. The paper is like 5 sheets for each answer, 5 pages for each answer. And for each section, suppose there are 4 sections. If it is 2 plus 2 plus 2 plus 3 or something like that, 5 sections, let it be 2 plus 2 plus 2 plus 2 plus 2. Step 1, they would have given a mark out of 2. 0.5, 1, 1.5, 2. 0.5 is the lowest mark. Now, step 2, again 0.5 to 2 will be marked. Step 3, if there is 2 steps only, I mean, section 1 and section A and B, 5 marks each, it will be marked from 0.5, 1, 1.5, 2, 2.5 till 5, it will be marked. So, the examiner is marking you based on the points you write. If in one page you have covered the points, you will get enough marks. It is not based on how many pages you fill. I hope I am clear. Okay, so don't worry that I have only see previously in a DNB exam, it was asked about the earache, causes for earache, and the management of wax in the ear for 10 marks. What do you do for management of wax in the ear? You just remove it. Okay, but there are different techniques for removing. Just write syringing, then removal with forceps, all those things. Means with the instrument and all those things. But students started worrying that what will I write for 10 marks? And you write all sorts of nonsense to fill 5 pages. There is no need. What the examiner wants is that you should not write nonsense. You should just write the point. That is what is expected of you. Just because it is 10 marks, you need not write other things that are not needed in that answer. That will give the impression that you don't know this or that. Clear? I hope I'm clear. Okay. So in the second answer again, you have to, when you write the management, it will also address the socioeconomic causes. If this child is anemic due to financial or other things, you have to look into that. If it is due to financial reasons, what will you suggest? There is a national program called ICDS, Integrated Child Development Scheme. You all know of that, where preschool children are given all the nutrition and all those things. That is where that type of thinking should come into the answer. So you will refer to the nearest PHC, nearest ASHA worker, and you will make them contact the nearest ASHA worker so that she will take care of the remaining things. Okay. Highlight or heading line is essential. If you are very sure that your point is correct, just underline it so that the examiner's eyes will fall on it. But if you're not sure, don't underline, because sometimes the examiner might miss it. So don't underline and bring the examiner to something that is wrong. Okay. So highlighting the headings or underlining the important point that you think the examiner should know that you have asked about, underline it. Okay. Shall we move on to the next question? So the next question is, 6-year-old boy, 13 kg weight. Father left family and child has 2 younger siblings. That is the catch in this question. Okay. It is very easy to define severe acute malnutrition. Severe acute malnutrition, if you write the 3 points, okay, that 3 marks you'll get. It was, I think the section A was for 3 marks. So you'll get 3 marks for that. Define severe acute malnutrition, you just write the 3 points. How to evaluate this child? In the evaluation, please mention the socioeconomic status also. Okay, evaluation starting with the history, whether that's the same thing, the diet recall and all those things you have to ask to know whether the acute malnutrition is due to lack of diet. Okay, and then the examination, the anthropometry, mid-arm circumference, whatever you want to write, you can write. And other vitamin deficiencies also you will look for in the examination. And you will classify, you can just write whether there are features of marasmus, features of Kwashiorkor, whether you will look into that also. So history is there, examination is there. And in the history, the special stress on the socioeconomic status. Now coming to the management, again, the SAM management, stable SAM has some management, unstable has another management. So both has to be mentioned. And then you have to Same, the last point should always be how you will support this family whose father has left the family, 2 other siblings, 6-year-old child with 2 more siblings, which means 2 younger siblings. Okay, so you have to address all those issues to prevent further malnutrition, and you have to check whether the other 2 children are also malnourished. That is the role of family physician. That will fetch you more marks if you write that point. But if you have not mentioned at all about the socioeconomic status, you will lose so many marks, because that is why this history has been given about the father left the family and the child has 2 younger siblings and all. Another thing is, if your handwriting is very bad, or if your language is not, everyone is not fluent in English. So if your language is not, you think that you cannot express it properly, and if you think that your handwriting is bad, just write important points rather than writing an essay type answer. Okay, if you write points and flowcharts without writing in full sentences or essays, that will be beneficial. If your handwriting or your language is not good, everyone cannot be fluent in English, and this is not a test of your fluency in English. This is to know whether you have knowledge about medicine, not about English. So you can just write the points. If you start writing in an essay format, all your lacunae in language and handwriting will come up. So better not write like that. Okay, you all know the subject, so just write the points. But don't write like as if you are writing a case sheet or a note, like put one arrow to one side, then one arrow to one side, then write in short forms, all those things. No, this is an answer paper. So please be neat and legible in your answer paper. Okay, so the third answer. For bad handwriting, can we go for all capital letter? Of course, you can go for if you have the time. If you think that capital letters is easier for you to write in the time limited, the time is very less. And personally, I don't know if I think capital letter takes more time than small letters. I don't know. Depends on your preference. Nobody will penalize you for writing in capital letter. You can write in capital letter provided your points are there. I told you this is not a test of your language or your handwriting. It is about your points. So write point wise, you will get marks. The 5, it is not compulsory that you should complete all the 5 pages, but you have to limit your answer to 5 pages. What happens is, some people write 3 pages the history, and then just only 2 pages remain for all these examination investigations and management. Then everything becomes confused. So how to write socioeconomic status? You all know, you can just write that I will assess the child according to the Kuppuswamy scale based on the, don't write the whole thing, based on the what all occupation, whether the mother, in this question, whether the mother is working, where is their financial income, whether it is a joint family, somebody else is supporting, the education of the mother, because whatever you tell the mother should be able to understand and practice it. So the literacy of the mother, all those things should be, that is what you write in the socioeconomic status. It is not like you write the Kuppuswamy scale total, the whole thing of the Kuppuswamy scale. No, socioeconomic assessment is the profession. I mean, if the mother is working, any other financial support, if the mother has enough finances, if the mother stays in the hospital, who is providing for the hospital stay, then about the educational status of the mother, all those things. Okay, is that clear? So now the next question.
Ma'am, one doubt, ma'am.
Yeah.
Ma'am,
Tell
in
me.
this case, we will be having only limited, like in this question, the question we were discussing. In this question, we
Yeah.
have only little information about the mother. So
Yeah.
how do we
So,
write the socioeconomic status of the?
yeah, you will ask, that is what you are not given anything, so you have to write that we have to inquire about the mother's profession, all these things, and then support the family accordingly. That's only needed. Just write that you will go look into that. Okay.
So we don't have to specifically
You
write
don't
about
have to
that
specify
patient.
that this child belongs to this socioeconomic status. No, You are looking into that and you are providing support. How do you provide support? The same thing. 6-year-old boy will come under ICDS. It is up to preschool children up to 6 years. So you can connect them to an ASHA worker. You can connect them to you all know about the MNREGA, no? If the mother is not working, you can connect to that. Okay. You can connect to some NGO to support them. That is what you should write.
Thank you.
Okay. Okay. So now the next question is IMNCI. Okay. So IMNCI is very important. Please read IMNCI properly. The current DNB exam, the last week which happened, had 2 questions on IMNCI. That is 20 marks on IMNCI. One 10 marks about IMNCI in a child with cough. Second 10 marks IMNCI in a child with diarrhea. So please be thorough with IMNCI. There is no shortcut to that. You have to learn it. But there is an easy way. You write, you practice writing how you will write a flow chart. Rather than mugging up the textbook. In the textbook, it is so confusing that you will end up with pink, green, red, then the assessment, all those things is so confusing for you. So you just make up your own scenario, like a child who comes with cough, without any features of this, that is without any chest in drawing or without high respiratory rate. What will you do? If that is a question, how will you write? If the child comes with this, with chest in drawing, how will you manage? Write and see. If the child has chest in drawing, respiratory distress, wheeze, how will you manage? You practice writing like that rather than mugging up the whole flowchart in IMNCI. Look at the IMNCI chart in the textbook and make your own case scenarios and write. In this question, it is IMNCI guidelines for fever in low malaria risk area. Okay, the clue is low malaria risk area. If you go into the IMNCI chart of fever, you know that there is high malaria risk area and low malaria risk area difference in the management. So just see that. I think you have to learn it, and then you many of this low malaria risk does not strike people. So what happens is you just write this and that. You write about malaria, you write about all those things, but even if you don't know about a fever in a low risk malaria area, there are some general points in IMNCI. What are the general points? Classify to pink, yellow, and green. Assess, first is assess, then classify according to pink, green, and yellow. And then do that is, in all cases, pink is referral, yellow is management in the OP, and then sent home with review after 2 days. Green is management at home. So that even if you don't know the rest of the things, at least write this much. Okay, how will you assess? You will assess for the general danger signs. You will assess for the symptoms related to what the child is having. Like in fever, what all you look. In cough, what all you look, like chest and drawing, respiratory. In diarrhea, what all you will look. At least you can write that even if you don't know the management. You can assess according to IMNCI these things, and then you classify. There are some general danger signals also, like persistent vomiting, convulsions, lethargy, all those things. Not taking orally, all those things. So even if you don't know the final part, you are not very sure about the specific management in a low malaria risk area, at least you write this, you will get pass mark. Okay. Another thing is what to look for in the mother. What to look for in the mother if child has this child is active, playful, and cooperative. So should be most likely a green case. Okay. So once you write the IMNCA part, you can write that since this child is active, playful, and cooperative, the child should belong to should be classified as green unless other danger signals are there. So we will manage at home with the home management. That much you can write even if you don't know what is a home management. Okay. And what do you look for in the mother in a child with fever? You will look for the mother having any fever, mother having any symptoms. The child may not manifest with the symptoms. Mother having any symptoms. What is the mother taking any treatment or not? Anybody else in the family having this? And then the mother's, same thing. Mother's educational level, literacy, mother's intelligence level, because you have to ask the mother to give home management or OP management, review everything. So you have to know all these things about the mother. I think the question was the mother part was only for 3 marks and the other part 7 marks was for the management of the child. So even if you write 2 or 3 points about the mother, I mean, you will look for mother fever in the mother, you look for other symptoms and signs in the mother. Maybe the child is late to manifest those symptoms and signs, and also you will look for the mother's whether the mother has understood your I mean your treatment plan and all. Okay. Now, the next question was the trickiest question of all, if I would say. Family medicine training in India, government hospital, relevance of the question was discuss the relevance of family medicine training in government hospitals in India. Okay, I think around 70% of you will be having training in government hospitals. The remaining 30% are in private hospitals who have no idea what is happening in government hospital. But still the question is being asked like this. So I feel those who are being trained in general government hospitals have an edge over the others in this question. But it is asked about the training, not about the practice of family medicine in a government hospital. The question is about the training in government hospitals. So what all will you write? You will write about the advantages of training in a government hospital and disadvantages. Whenever you are asked about discuss something, always I give this example of syndromic management. Previously, I know it is very difficult to write. That is why I said this question is a most difficult question. So, if there was a question previously about syndromic management of vaginal discharge. Okay, I'll come to the point about this question later. The question was merits and demerits. That used to come in most question papers. Merits and demerits of syndromic management. What are the merits? Merits said are that any peripheral health worker can assess the patient and give treatment because there is a syndromic management. There are kits for management and anybody can give. Okay, one of the merits. What is the demerit? The same thing. Same thing as the demerit. Because you are not assessing evaluating the patient properly. Got my point? It is a merit as well as a demerit. Okay. The same thing applies to when you write the advantages of training family medicine in government hospital and the disadvantage. What is the advantage? Advantage is that there is a lot of patients that you can see. There is a patient load, heavy patient load. Those who are working in government hospitals know heavy patient load, and so you can know the different types of cases that present to a government hospital, and you are daily working in the getting trained in managing these patients. So the heavy patient load is an advantage. Okay. And the other advantage is that most of the government hospitals, theoretically, yes, but practically may not be there. But theoretically, most government hospitals are linked to the national health programs. And so you are getting trained in that, how to coordinate with the national health programs, how to coordinate with other specialists, how to refer to a higher center, how to manage in the setup that is with the facilities that you have, whether you're being, because most of the training happens in a district hospital and hospitals above the district and general hospital. So you know what are the cases that come referred from a primary care or a CHC and how that can be managed in a tertiary hospital. And because you know that, you know what all should be referred from a primary care hospital or a CHC. When you work as a family physician in a primary setup or a secondary setup, what all you should refer to a tertiary care setup. That you will know when you're working in a general hospital or a taluk hospital or a district hospital. So that these are the advantages, and you know what are the national health programs and how it can be integrated to your practice. And you all know what are the support systems that are available in the government to help people who are in the poor socioeconomic status who visit the government hospitals. What are the insurance schemes available? All those things. So Maybe practically all these things are not there, but these are the advantages of getting trained in getting family medicine training in a government hospital. So what are the disadvantages? Again, the patient load is a disadvantage in the sense that the teaching faculty are not mostly academicians, they are practitioners, and because they have a heavy practice load, the principles of family medicine comes in the second part of the question. I'll answer that. So this is when the practitioners are overloaded with the patient load, the academic part of it, and they may be not be in a position to guide you. So most of the times your work is unsupervised. So unsupervised training is a disadvantage because of the high patient load. Okay. So the patient load is a good thing as well as a bad thing, because sometimes you do things unsupervised and by trial and error. So these are the points that should come in the training in government hospitals. So the second part of the question was, what are the principles of family medicine? As a family medicine resident, you are supposed to know the principles of family medicine. All of you refer to Ian McPinney. If you want, I'll type it here. Ian McPinney. Just Google it. Ian McPinney's 9 principles of family medicine. Okay. I'll just type it. Ian McPinney. Just go to the net and okay. So go today itself, read the 9 principles of family medicine. Okay, no need to write word to word correct. You can write in your own language provided the concept is right. And you can elaborate if you have time. If you have time and space page, you can elaborate in whatever way you want. But the basic concept should be there, not word to word. Word to word correct. Even I don't think even Ian McPinney, if he comes back and writes, he might not be able to write word to word. So you can write 9 points. The concept should be clear. That's it. Okay. Even if you miss 1 point also, no problem. See, you all are writing to, why are you writing this answer paper, to pass or to get distinction? So just because you don't know the ninth point, don't think that, oh my God, I'm going to fail. No. Whatever points you know, you write. Okay. So that was the trickiest question in this paper. Because this question just takes you back, that you think, oh my God, what do you write? It is okay if you write 9 points in 1 page. You need not elaborate if you don't have the time. I wrote in my own words, but got big 0. May not be the concept, may not be right. You can write in your own words, but the writing in your words, you should write the principles itself. See, writing in your words does not mean that you can write whatever you want to write. No, the 9 principles, you can go and read. See, there is a question like, there is a principle like seeing the patient at a hospital, home, or in the patient's own setting. In any setting, you can elaborate it as you will see in the clinic, you will see in the home, you will see the patient at hospital. So if you write that in your own words, you will get marks for that. Okay. Another point is to see the patients, to see the population as a population at risk. What does it mean? You will educate every patient, because you see that every patient who comes to you is a patient at risk, population at risk. So you will do health education. You will do preventive. You will consider the preventive aspects. Okay. So if you write in those words, you will get marks. But writing in your own words what you think are the principles of family medicine might not be applicable. These 9 points, if you write in your own words, is not an issue. You will get marks. Hope I am clear. Okay. Now the next part is the stage assessment. How relevant in diabetic patient with poor compliance. Another thing. 3-stage assessment you should know. 3-stage assessment is very important in family medicine. What are the 3-stage assessment? Clinical, individual, and contextual. Okay. The concept is that clinical is what you always do in medicine from MBBS. Individual is the related to the patient. Other things related to the patient. Contextual is the social, family, other backgrounds. So in each part, what will come? SOAP. I think all of you have heard of SOAP. SOAP is subjective, objective, assessment, and plan. S is subjective, O is objective, A is assessment and plan. So clinical itself, clinical subjective means what? History, what the patient gives, the symptoms. That is a patient. Subjective means what the patient thinks. Objective is what we think, what we find out. So in the clinical part, subjective means what the patient says in history. Objective part means what we find on examination. Assessment is what finally we think could be the differential diagnosis or the diagnosis. Plan is what is our plan to manage this medical problem. Okay, clinical. Now coming to the individual. Individual, what are the things? What are the other things in the history that the patient says in relation to, which are not related to the clinical part? Like patient may be saying that I am worried. So now you have to give an example of a diabetic patient. That is a question. So the diabetic patient may be worried about whether this diabetes will never get controlled. If I take medicine for long, what are the usual concerns? Will it damage my kidney? What are the side effects of the medicines? All those things are the usual concerns. So that those you can write. The patient might have different concerns, so that you will assess in the individual part. That is, the patient's concerns will be in the individual part. And in exam, in the objective part, what all you will dig further into their cause for worry. They may be worried because sometimes their friend who had diabetes would have had a CKD, and they may be thinking that it is because of the drug, or they may be thinking that insulin is harmful for health. They may be thinking that insulin is financially the thing. So you are asking this again, and you are making sure that these are the things. That is objective. And assessment is, you think that either the patient is anxious, or the patient is distressed, or patient has some concerns about this. That is your assessment. And plan is, you will counsel about this. If the patient is having some neuropathic pain, you will address that in addition to what the patient has come for. Contextual part is contextual. What are the family, who are the family members? What is the income? Is the patient telling about all those things? That will come in the subjective. And when you assess the socioeconomic status, that will come in the objective. Whether you will assess whether who is the bystander. Sometimes no family members would have come as bystanders. It would be a friend or a random neighbor who brought, or he would have been found somewhere and somebody would have brought. So all these things, you can imagine anything and write. Okay, you are free to write the three-stage assessment. How you will apply the principles of how you will apply three-stage assessment in a diabetic patient. Then according to that, you will assess the patient's socioeconomic status and all those things. You will plan for the same thing. You will plan for support. You will call the relatives and discuss about the patient's problem. You will also tell about the diet to the relatives also, because the patient may be worried that 2 types of cooking cannot be done at home. Okay, most of the patients are worried that they think that anyway, especially females, they think anyway that I have to cook for the whole family, so I'll also eat the same diet. So you have to counsel the patient as well as the family about the diet, about the exercise. That is how that answer has to be written. Okay. First you write, this is 3-stage assessment. And in the 3-stage assessment, in all categories, you will assess the subjective, objective assessment plan. And in example of a diabetic patient, these could be the presenting problems. And when you assess, these could be the things. These could be the patient concerns. This ICE, idea, concerns, and expectations, you can put in the individual part. Contextual part, you will ask about the family, social setup, all those things. Is that clear? So now the next question. 34-year-old female with 8 months pregnancy brought with seizures. Migrated from another place, hence missed ANC checkup since 3 months. Causes of seizure in pregnancy. I think causes of seizure in pregnancy, you can read from the textbook, you can write. The most important cause that comes to your mind is eclampsia. Okay. The other causes, the patient can have any other causes. It could be a chronic epilepsy. The patient could be having a seizure disorder from the beginning itself. You don't know. So that could be another cause. It could be an infection, a meningitis or an encephalitis that is causing the seizure. Okay, it could be a new onset due to some metabolic causes, hyponatremia. Any cause of seizure you can write. But the first cause should be a preeclampsia. Okay, 34 with 8 months pregnancy. So the first cause should be preeclampsia. You can just mention the causes. Now, how would we prevent it? How could we prevent it? We could have prevented it by having a proper ANC. Now you prevent, how you will prevent if it is preeclampsia, if it is eclampsia, you will give magnesium sulfate, you will give antihypertensives, you will monitor all those things regarding management and prevention of eclampsia should be there. And this could have been prevented if the patient had a proper antenatal checkup. So further to avoid this, you should tell the patient to come for what all? You should come to tell the patient to come. You should tell the patient to come for regular antenatal checkup. You should do the monitoring. You know how the antepartum fetal surveillance is being done, like the NST, biophysical profile, Doppler monitoring, whatever is needed, required. Daily fetal monitoring, daily fetal movement count, all those things. Whatever you know about preeclampsia surveillance, you have to write. And the third part is what is it? Components of ANC care. Components of ANC care, you know. What are the components of ANC care? Whatever you do in ANC, the investigations you do, the checkup you do, the different duration of the checkup, the first how many in first few months, how frequently you have to do the ANC, then how you have to, then in the next trimester, how is the frequency in the last trimester, and what all you will check in each trimester, when will you monitor for GDM, when will you check for GDM, when will you check for PIH, all these things, when will you when will you ask the patient, when will you think that the patient is a high risk patient, all those things should come. In management, only drugs name mention or with dose and route. If you know the dose and route correctly, you can write it. If not, at least mentioning the name will do. Okay, there is no rule that you should write, but some things like, suppose it is a febrile seizure in a child. Was it your question? No. You have to write the dose. And preeclampsia, magnesium sulfate dose is important. Okay. Other things, even if you don't write, it is okay. But some things, I think by the time you learn, you will know that there are some things that has to be known. But if you write magnesium sulfate and you did not write the dose, you will not get 0 marks. You will get at least 0.5 or 1 mark. Got it? It is not that unless you write the full thing, you will not get any mark. No, if you mention the name, you will have mentioned the name of the drug, you will get some marks. If you additionally mention the drug dosage, you will get more marks. But if you are, if there are many, it depends on your learning style. If you think that the dose and the route you cannot remember, please do not waste your time memorizing that. Okay. If you are weak at remembering doses, leave it. At the last moment, don't try to memorize the doses. Okay, at least the name. Be sure with at least the name. Okay, Pritchard's regimen, you can write. At least if you know the name of Pritchard's regimen, just write that. If you don't know the name of the regimen, don't write it. Don't put a dash and write regimen and all. That gives makes the examiner know that you forgot it. Otherwise, the examiner will think that okay, the examiner might not register it also, that you have not written the name. Okay. So that is it. Now the 8th question. Few children in your PHC area are low weight and height for age. They are thin, have brown hair, shabby clothing. Assessment of malnutrition. The same question has been repeated. The same thing itself. Assessment of malnutrition, again, history, examination, and investigations. History, what all will you ask? I already told in the SAM question the same things. Examination, you will examine for all the anthropometry, including the vitamin, nutrient, other nutrient deficiencies and vitamin deficiencies. And the investigations, relevant investigations that you will do. Actually, if you know malnutrition, you could get 10 plus 10, 20, maybe 2 or 3 marks, less 7 plus 7, at least 14 marks. You can get in this. How to teach health workers to train mothers? The easiest part. No, you all are trained, but you don't know how to write it in an answer paper. That is the issue. So what all will you train? You have to teach health workers about the diet. First of all, you have to teach the health workers what diet the child should take. So, and that the health workers should educate mothers. And there are different methods to educate mothers. What are the different methods? They can organize a role play. They can conduct a lecture. They can make posters. They can show them videos about how to manage. Okay, you know that all these things are being done in the community by health workers. But to write in an answer paper, when the question comes, you think, what is this? Why have they asked this? How should I write this? But you know, the health workers, they do all these things. They exhibit posters, they show videos to mothers, they organize this camps to educate the mothers. With what is that? Village Nutrition Day is there, isn't it? So on those days, the Anganwadi workers and the Asha workers will organize camps for mothers to educate them. Okay. Clear? It is not a big deal to answer this question, but I think when the question comes, you are like confused as to what to write. Now the next question is almost the same thing. Nomadic population staying in tents in your area, selling idols and drums for their living, comes for few months in a year. What health problems are anticipated in these migrants? How would you organize a health camp? Generally, what are the health problems that you see in people? Generally. Same thing applies to nomadic also, a little bit more. One is nutritional problems, malnutrition, iron deficiency, other vitamin deficiencies, all those things. Just because they are nomadic, again, their nutrition may not be adequate. They may not be having regular checkups. So that nutritional problems you anticipate. Then what you expect? Hygiene. Due to lack of hygiene, you expect certain problems. Okay. Like infections you expect in these people because they are migrants. They come from another state. They can bring infections from other state or other places of the country. Like in a malaria non-endemic area, they can bring malaria. In a dengue non-endemic area, they can bring that. So they bring infections from a non-endemic area to endemic area. So nutritional problems, hygiene related issues, infections. The infections itself you can classify as foodborne diseases, waterborne diseases, vector-borne diseases. Just classify and write. Another thing, another important technique to get marks is to classify and write. Okay, classify and write, then that means the examiner gets an idea that you have some idea about these things. You are thinking in an organized way, you are thinking in a systematic way. These are the health problems that can come to migrants. There can be unwanted pregnancies, illegal abortions, all these things also can happen in migrant workers. Whatever can happen in a people in a lower socio-economic strata who are not having regular checkup, all those things you can write. Sexually transmitted diseases, all those things. Okay, how will you organize a health camp? You will organize a health camp with the local health agencies or with an NGO. You will inform these people early, and then these are all things that you do when you are in training. I think all of you are doing this, or you might have seen your seniors do. Just write it point wise. That's all. Inform the an NGO or somebody who can give a financial support. You will inform the local MO of the PHC. You will coordinate with the health workers like the Anganwadi workers and ASHA workers, and then you will you can organize a health camp depending on the age. You will organize camp for children, for women of reproductive age group, for women of postmenopausal age group, for men who are working. So you will organize different in different sections. You can have health camps and address their problems, and you can dispense medicines which are needed. If you think that there are some things which should be evaluated or referred, you can have a tie-up with the nearest health, a district hospital or something, and then you can do that. I think it is clear, that answer. The last question is, 16-year-old teen came with weakness and vomiting for 3 days, UPT positive. She says she missed her period. What advice will you give to her family? So, adolescent pregnancy. So, adolescent pregnancy, you have to discuss with the parents, discuss with the girl the pros and cons of this pregnancy. That is, what are the, there are not many pros, only cons, because this child is 16-year-old. So you have to tell about the MTP, what can be done, but if the child has come after the, the viability period, then you cannot do that. So you have to advise the family regarding how the pregnancy should be, how the ANC should be done, and what should be done after that. You should give support to the girl as well as the family. So one important thing is that you should not be a moral police at that time. You should be a doctor at that time. That is what you have to write. You should not judge the, you should not write movie stories in this answer. Okay. You have to discuss the health problems. That is what is more important. Health problems for the girl and for the child, if the child is, for the fetus and for the child. So counseling of mother is the, what do you mean by counseling of mother? Mother of the girl or the girl? Girl itself is going to be a mother. So counseling of, I didn't understand counseling of the mother. Mother of the girl. Why the father also has to be counseled? Was a question asked about mother itself? Family, no? Everyone has to be counseled. Counseled about giving proper mother counseling was asked. Okay. So mother has to be counseled. I thought it was family. What advice will you give her family was the question. No, it was about mother. Okay, good. If it was, if it was specifically asked about mother, you have to tell about the diet, nutrition for the girl. If the viability pregnancy has not reached viability, what are the options for medical termination of pregnancy? If they are planning to continue the pregnancy, how to give adequate antenatal care to the child, the nutrition to the girl, the nutrition, the mental support. The girl should not go in for any depression or even postpartum period also. About all those things, whatever any other antenatal girl could have, all those things should be assessed. The most important thing is that you should not, you should tell the mother that you should not blame the girl unnecessarily, creating more psychological issues for the girl. Either if it is before viability, you have to terminate the pregnancy. You can advise the options for termination of pregnancy. If not, the proper antenatal care. You should advise them about illegal abortions. Do not go to centers which are not registered for abortions and go for illegal, unsafe abortions, which will cause more infection for the girl and which can lead to death of the girl. Okay. Both you have to write. You have to write about MTP. You have to write about illegal abortions, safe abortion services where all are available. But if the viability period has this thing, you have to write about ANC, but not all detail about ANC. Like in any other, proper antenatal care should be given. And because it is a teenage pregnancy, it is a high-risk pregnancy, and so more care has to be given. That's all. You need to just mention that. You need not mention all the ANC care in detail for this. The safe abortion services as well as the high-risk antenatal care. These are two things that should be there. So, HEADS assessment in adolescent. Please go through Google, net, wherever. I think there is a PPT I have. I think if you need, I'll share it with Vishnu or somebody. HEADS assessment is, the important points are H is for home, health and all, E is for education, employment, A is for addictions, D is for drugs, like that, depression, all those things. So that assessment, just elaborate the HEADS. 'That's all. This was a question. Uncontrolled diabetes and DKA with that patient's husband died. So what social assessment would you do for her? That was in this question paper or any other question paper? Okay, what is the question? The question is paper 1. Okay. So paper 1 was that about which question are you asking about? Elaborate or explain? I'm confused. Elaborate or explain is related to which question? Dr. Manvendra? Elaborate about MTP, is it? Just write about MTP services available. That's it.
मैम वो हेडनेस वाला जो क्वेश्चन था उसके बारे में ओनली
Heads is just what are the points? Like H stands for what? E stands for what? That's enough. Okay, if you have time and space, you can elaborate. But even if you write what H stands for, what E stands for, what A stands for, that will fetch you marks. Okay. Now, this is uncontrolled diabetes and DKA. A lady's husband died because of uncontrolled diabetes and DKA. So what social assessment, or was it a psychological assessment? No, social assessment you would do for her. Again, same things. You have to assess the patient's financial status, the support. That is where the family assessment tools come. I think that was what is meant in this question. You have to assess the socioeconomic status, the support for the patient, the mental health issues in the patient, whether the patient is depressed, anxious. So you have to assess the psychological assessment, do the social assessment, financial, economical assessment, all these things. Family support, this all will come. Regarding the history, you have to ask whether the patient has any physical symptoms also because of this, because maybe the patient is also having some other illness. So that also you have to ask. Is that okay? So no need to write the husband has already died, no? Because of DKA, isn't it? Or the patient is having DKA. I didn't understand. Is the lady having DKA or lady's husband and had, woman had DKA and her husband died. Oh my God. Then you have to write about DKA also. You have to write, you not write the full management of DKA. You have to manage the uncontrolled diabetes in the lady. I didn't understand the question very clearly because Vishnu had just sent me the third paper question. So the question was, a woman with uncontrolled diabetes and DKA, but her husband died, how will you assess? Isn't it? Okay. So you have to assess the physical symptoms. Good. So you have to assess the physical symptoms. That is where this 3-stage assessment again comes. You have to assess the patient's symptoms, patient's problems related to diabetes, DKA, and you have to manage accordingly. You need not write the complete management of DKA. You can at least write the principles of management of DKA because you will not get time to write everything. Okay. So principles of management. What are the principles of management of DKA? Insulin, fluids, potassium correction, regular monitoring. Okay, these are the monitoring of sugar, sodium, potassium, acidosis, ABG, all those things. So these 4 principles should come. Insulin management, IV fluid management, potassium correction, and regular monitoring. At least you write these 4 points. And how you will manage, how you will counsel the lady about uncontrolled diabetes, about her diet, about her exercise pattern, about her compliance with the drugs, oral or insulin, all those things. And then you go to, because the husband died, what is her financial, who is supporting her, what is the economic situation, what is her psychological symptoms. If you write it classified as the same as I said for 3-stage assessment as the clinical symptoms, the individual symptoms and the contextual. If you write it like that, it will fetch you more marks. Is that clear? Once again, tell about the counseling of adolescent pregnant girl. For the pregnant girl, you have to again counsel about the problems that she can have if the pregnancy continues. So if she is willing for abortion, to go for a safe abortion service, safe abortion practices where it is available. If she's continuing the pregnancy, you have to counsel the girl about the the risk factors, high risk of this adolescent pregnancy, and ask her to have proper nutrition, all those things. Never tell about, don't mention about criticizing her or blaming her for the pregnancy. That should not come in your answer. That is the main thing. Okay, you should not victimize the patient by asking about all those things. Now, in a 16-year-old adolescent pregnant girl, 16 comes under POCSO. I think so. I think 16 and below comes under POCSO. So you can tell the family about if it is if it was a sexual abuse, the parents should intimate regarding POCSO also, and the doctor also should intimate that. Okay. Euthanasia definition, euthanasia, Indian laws, and what to counsel the relatives. India has no laws about euthanasia. So you have to counsel the relatives about that. There comes the principles of medical ethics. Medical ethics, in that it comes that you should discuss with, you should do what is good for the patient. You should not do any harm. You have no right, according to Indian law, you have no right to kill the patient, or you can withdraw the supports depending on the patient's condition. You can withdraw the aggressive management, or you can withhold aggressive management, intensive management, after getting proper consent from the patient, from the relatives, if the patient is not in a state. So you have to discuss with the relatives, and you have to get a consent for withholding an intensive management, and then that stands. Okay. Otherwise, you cannot give a drug to to facilitate death in the patient. Will it be wise to incorporate 3-stage assessment in all types of questions with health issue? Yes, it will be very wise if you can do that. If you don't know to incorporate, don't. But it is very wise to incorporate, because nowadays most of the assessment is done by family medicine faculty itself. So once that comes, you will get an extra edge to your answers. But if you don't know how to incorporate it, please don't. How to decrease steroid use in community? How to decrease steroid use? You have to have, these are some individual, community, and legal level. Okay. Individual level is you have to educate the patients about the side effects of prolonged steroid use, excessive steroid use. Okay. The same thing about antibiotic also. The side effects you have to counsel, and you have to counsel about the duration. Whenever you are prescribing a steroid, you have to prescribe the exact dose, exact duration, the timing, all those things, so that the patient does not take more than that. If the patient has no relief of symptoms for which you have given steroid, the patient has to follow up with the doctor. Always steroids have to be used only under guidance by a doctor. The side effects of steroids you have to advise, and then the community level you have to, this is the individual level to each patient. Community level, through your posters or health awareness classes, or through short videos, or through social media, or through print media, you can make the people aware about the side effects of steroid use. Legal level, what you will do, you can the government can initiate rules that the pharmacies should not dispense steroid without a prescription of the doctor, just like in antibiotics. So such type of laws, if it come, it will decrease the steroid use in the community. Is that clear? It's already, I think, 1 hour and 15 minutes more. So I expected a half an hour session. It went up to 1 hour and 15 minutes. So I hope you have an idea of the main thing is you have to manage time. You have to manage the number of pages. You have to think systematically. You practice answering question papers and then write. Okay, you all will pass. The only thing is you are a bit nervous when such questions come. that you are worried how to put the answers across. Okay.
There are
Yes, Vishnu, I think.
actually the motive of conducting this section was actually two things I had. One is I wanted to just convey to you that the questions are relevant to family medicine and they are actually expected questions, because there is a lot of criticism that paper 3 was hardcore PSM. It was not actually hardcore PSM. It is mostly relevant, not mostly, almost everything was relevant to family medicine practice. And second thing which I noticed was that the real issue was in how to keep the paper. Not that you don't know the stuff, but what is to be presented when you are writing the paper. That was the main reason why many people had some issues in scoring marks. So that is the core reason why we had thought of discussing, at least because paper 3 was the most critical thing. So we came up with this discussion. I hope that this was of much benefit to you. And what I would say is, with these aspects in mind, you have another 48 days because your calendar is already out. Exam is on 13, 14, 15 of December. So with this core aspects, what you have discussed in this last maybe 1.5 hours, you have to practice for the next 40 days. How to, and you have to actually write and practice the exams, and which will definitely help you score good marks in your exams. So if you have any other queries, you can reach out to me or any one of us in Spice Route or AFPI or any friends or seniors you have. We'll be happy to help you out. So I think we can conclude the session. Thank you, ma'am,
Okay.
for
Thank you.
this much efforts and almost more than 1.5 hours around to have a detailed discussion. Thank you.
Thank you. Thank you all. All the best for your exams. All the best. Bye. Good night.